Hello, I'm Frank Williams, and today we are conducting our first interview from the Life Provision Studio. And we're really lucky because we have Doctor of Holistic Medicine and Clinical Hypnotherapist Victor Tsan. Welcome.
Thank you.
In brief, short definition, what is hypnosis?
In brief and in short definition, the hypnosis is a patient's condition when patient is open for suggestions. Another word, by doing a progressive induction, we are trying to relax our patient and put him in what we call hypnotic trance. And being in this hypnotic trance, patient becomes open for suggestion. And at that moment, we can put the right program, the right instruction in his mind.
So, in terms of the practice, what are some of the procedures that you take to, hypnotize somebody?
Every hypnotic procedure consists of 4 major steps. Number 1, it's induction, when we are trying to relax our patient. Close your eyes, make a deep breath, relax, try to point your attention to your head, make sure your face is completely relaxed. Now go down to your shoulders, to your hands, and so. That's the first step. The second step is when we are checking the level of relaxation. It's very important because we need to know, should we continue to relax our patient or she is ready. So we perform the relaxation test, depth test. And depending on result, we usually do what we call deepening, which means put this patient even deeper in hypnotic state. And after deepening, the shortest part of the procedure is a script which contains our instructions depending on which goal we are trying to reach. So if we're trying to help this patient to quit from smoking, it will be instructions about smoking. If we're trying to reach the goal to lose weight, it will be instructions about how to eat, how much to eat, what kind of food to use, and so. If this is a patient with depression, we will try to give her a set of instructions of how to control her mind, how to react to the general condition around.
Stay positive.
Stay positive, get proper reactions, not to be confused and so.
Okay. And I hear that, hypnosis works for some people, but not for others.
That's not true. That's not true. From hypnosis point of view, all people could be divided in 2 major categories, analytical and non-analytical. Non-analytical people, it's more people with kind of people who are open for suggestions without hypnosis. People who trust, people who are ready to communicate. And the other category is analytical people. It's very easy to understand these 2 categories. Imagine a soldier who is always follow instructions and orders from his, from captains, lieutenants, generals, and so on. Okay? He is non-analytical 90% of the time because he's already has a habit to follow instructions.
There's that regimented thinking.
Yes. The opposite is general, who has a habit to give instructions and don't want to accept.
Do those types of people tend to be, closed-minded? And
Yes, you can say so.
okay.
So,
In order for hypnosis to work, you have to be open-minded?
no. The non-analytical people like soldiers, they are very easy to be hypnotized. Easy. It's a matter of seconds sometimes. The analytical people, everything we have to do, just use a different technique. And they are also hypnotizable. So it's not true that some people cannot be hypnotized. They can be. When we are performing our hypnotic session, we are trying, our goal is to talk to patient's subconscious, not conscious, but subconscious. And for non-analytical people, this subconscious is always open. Very good example. Imagine in that room there is a subconscious. And I need to go to that room in order to give a good instructions. But on a door, there is an English guard with an automatic weapon. So, if this is non-analytical person, this English guard is not really very strong. He can spend a couple minutes to smoke cigarettes. He can get out from the door and do something, maybe make a phone call. In analytical people, this guy will never let you go in. He is standing at the doors and he knows what his task is. But the good thing is that if we can find some kind of work for this English guard, make him interested in this work, he will start doing this work and he will forget about the door. And at that moment, we can go in. And in hypnosis session, it's very easy. All I have to do, I have to give to the patient some kind of task. For example, imagine that you are asked to write a book about boys and girls' names. So what I want to ask you, when I tell you to start, you have to think about boys and girls' name on each letter of the alphabet. For example, A, Alice, A, Avram, B, Boris, B, Bella, whatever. All you have to do from A to Z, find these names. When I give this instruction to the patient, his guard, his English guard, starting to write this book, and he opens the door. So at that moment, I can go in
So it's
and
almost
work
like,
with subconscious.
it's almost like a diversion.
Exactly.
So you create the diversion in order to create the opportunity for entrance into the subconscious.
Exactly. Yeah.
It's really interesting. Now there is, there's a lot of questions that I have, and I actually made a little list in terms of, hypnosis. it's shrouded in, myth and urban legend. And I'd like to, at this time, if, you're okay with it, I'd like to just either disprove or validate some of the myths that there are about hypnosis. So, in terms of hypnosis causing serious mental damage, is that true or false?
Absolutely not.
Absolutely not.
Absolutely not. So I will disapprove. I can do with patient everything I want after I put him in hypnotic trance, as long as he wants the same. So if he came to me because he wants to lose weight, I can give him all possible instructions about what kind of food to buy in supermarket, how to prepare this food, how to eat slow, how not to eat when you are not really hungry, and so. And he will get all these suggestions. Easy. But in any moment, if I say something which he doesn't like, let's say I say, and now go take a gun and shoot around. He will open his eyes and says, no, doctor, sorry, session is over. So, yes, we can keep patient under control as long as she wants it.
Oh, we sort of addressed the next one, because I was going to ask, can you keep a person under hypnosis against his or her will?
No, absolutely not.
Okay, so there's no truth to that.
No.
All right.
And you probably asking these questions because you saw a lot of hypnotic comedy shows.
Watch a lot of TV. Yeah,
Exactly.
Watch a lot of TV.
The hypnotic comedy shows, it's a different thing. It has nothing to do with hypnosis. What hypnotist does during this show, he first call to the stage 50 people. He check who from these 50 people are non-analytical and who is analytical. He let all analytical people go back to the seats. Then from non-analytical people, he is trying to select the most hypnotizable.
In terms of selection, how does that work?
Or it's a couple of easy tests. For example, put your fingers like this. Now, imagine that I put a loop around your fingers.
Okay.
Okay? Now close your eyes. And imagine that I'm trying to tie this loop. I just want you to see it in your eyes, how I do this. I'm trying to tie it stronger, stronger, stronger. Open your eyes.
Oh, wow.
You are non-analytical. So if I do this test, I will leave you on stage.
Interesting, because
Now,
you can hypnotize me.
And the second component, if you came to this show, if you're not analytical, if you already paid money for ticket, if you get to the stage, you want to be involved. And if you want to be involved, I can give you all possible instructions which you want to follow. So I can say, well, Frank, now imagine you are on a beach and it's very hot there. Maybe you want to take off your shirt? And you will start doing it. Why not? Because you want it.
Now, I guess that's within limits, because, if there's people that, perhaps don't want to, then that's when they would end the hypnosis.
Exactly.
Because they would have the control.
Exactly.
What about in terms of another, urban myth, perhaps, in terms of when, people are hypnotized, can they recall their forgotten past? Is there any truth to that?
Yes, absolutely. Absolutely. It's easy. We can help people to find lost things.
Stored in the subconscious?
It is in subconscious. All we have to do just to help this patient to recover it from subconscious.
Okay.
Yes, and it's very easy, and we do it at least 2-3 times a week.
Huh.
People call us, listen, mostly women. listen, I lost my engagement ring. Where do you think you lost it? I think at home, but I'm not sure. Okay, come to my office.
So actual physical items, they...
Yeah, physical items. So I started with this patient. I put her, usually her, in hypnotic state. And I started to talk about that day. Do you remember what time did you wake up? Oh, yes, it was 7:30. Can you be more precise? Yes, it was 7:24. Very good. How do you know? Oh, because I have electronic clock on my nightstand. What color of electronic clock? Well, it's green. Okay, very good. So what did you do then? Well, I went to shower. I'm sorry, I need all details. Did you went to a restroom? Did you have your business done before shower? Yes. I have to point patient's attention on any possible minor details. Even brand of toilet paper, which was used that day. And while we go through that day, at some point, the patient says, well, I put my ring on a shelf in a bathroom. I said, call your husband, ask him to check. She's calling, yes, it's there.
Now, you said that it's mostly women. Does that have something to do with, in terms of hypnosis, do women tend to be, more...
No.
Okay.
They're usually losing their engagement rings.
Okay. So they're probably more they're the ones more likely to ask for help, I would imagine, too.
Uh-huh.
In terms of remember that. What about in terms of repressed memories? Like, memories that are sort of like forced away. Do people call asking to recover those, those thoughts as well?
Yes. Sometimes, yes. And again, it's not difficult procedure. It is not. As long as she is non-analytical.
Okay.
With analytical, this kind of trick is more complicated. Significantly more complicated.
Okay. True or false? Hypnosis only works on impressionable people.
Not only. Different technique should be used for analytical people.
I was going to say, it probably comes down to whether or not the person's analytical or not.
Yes, right.
Okay, and in terms of, being a hypnotist, which you're a hypnotist, do you need any kind of professional license in order to, hypnotize somebody?
Certification.
Okay, certification.
Yes. So I had a chance to graduate my first hypnotic school in Great Britain, in Royal Institute. Then in Belgium. And then here in the United States, in the American International School, located in Maine.
Can people that aren't licensed, are they capable of hypnotizing somebody else?
Yes.
So even without the training, it is something that's possible.
Some people were born with this gift to hypnotize.
How do they discover that gift? Is it something that just, one day all of a sudden...
It just happens. Yeah, It just happens. One day, suddenly.
Suddenly, it just happens. Can a person be hypnotized into feeling no pain?
Yes, easy.
Really?
Easy. Yes. For example, in about 5-7 minutes, I can hypnotize person and in front of camera put a long needle in his arm and he will not feel it. It doesn't even require deep hypnotic state.
Yeah, I've heard stories about people being like sliced open while under hypnosis. Is there truth to that?
No.
Okay.
Not sliced open.
All right.
But some kind of, in our office, because we're doing a lot of acupuncture sessions, we have acupuncture needles, and when I want to show my patients what I can do and how they can not feel any pain. I
Yeah.
take acupuncture needle like this, put it in, they don't even feel.
And it's a form of therapy. It's therapeutic.
No, it's mostly trick.
Oh, mostly trick. Okay.
Yes, I just show them that I can make them painless.
Okay. Now, in terms of hypnosis, it is something, obviously, people calling in to, find lost items. But do people call in just to, meet and, get ideas out and sort of like just be hypnotized for their own, mental health, their own mental well-being?
Yes. It's very often. We're doing hypnosis sessions for fear of public speech. Another sessions for what we call money magnet.
Okay.
When what we are doing, we are giving set of instructions to patient how she should feel and be self-confident in business.
That's interesting.
How she should communicate with people around him, with people who is working for him or with people who he work for.
And there's an active transfer from the subconscious to the conscious when the hypnosis takes place? Or is that something that it has to happen over a period of time?
It takes about 15 minutes to transfer.
In terms of long-term effects though, and somebody, say for instance, if somebody has a fear of public speaking and you hypnotize them in order to help, fix that, help them, overcome that fear. Is that something that takes a series of sessions? Or?
Yes,
Okay.
about 5-6 sessions, once a week. And in between, we usually give to this kind of people CDs with our voice, with the same session, and these people can listen it at home.
Hopefully not while they're driving.
Of course not. Well, each CD starts with, please do not listen to the CD if you are driving.
Oh, there's an actual disclaimer on every
Absolutely, absolutely, a must.
So you said that people that aren't licensed, haven't been trained, sometimes have a gift. Is it possible for somebody to actually hypnotize themselves? I mean, could I hypnotize myself if I wanted to?
I can hypnotize myself. Some people can hypnotize themselves. However, I would recommend them to come to professional hypnotist and get some kind of education. I'm talking about 1, maybe 2 hours. Because, first of all, the patient who wants to hypnotize himself, he should know at least basic what he can do, what he cannot. He should know how to create instructions, what kind of language to use. Because the interesting thing is that, as I said, when we performing hypnosis session, we are talking to subconscious, not to conscious. And subconscious is very different from our conscious. For example, subconscious doesn't understand humor, so no jokes. When I'm working with a patient, when I'm giving instructions, no jokes whatsoever. Subconscious don't understand it. Subconscious don't understand difference in time. Nothing can be in the past, nothing can be in the future. Only in present time. So even if I want to say that you will not smoke again, I cannot say not, and I cannot say you will. So I have to say you already quit from smoking. No not, no will. No was.
Because of time.
There is no time
There's
for
no sense of time.
subconscious.
It's sort of like when you're sleeping, I guess.
Huh?
When you're sleeping, I mean, you go to bed.
Everything
and
goes
you wake
around
up,
you, right?
You don't remember certain periods in the night when you were sleeping.
Exactly.
You know, just all one.
Exactly. And by the way, I probably have to make one explanation here because it's very important. You may heard from some people, maybe even from some newspaper, that hypnosis can be dangerous. The answer is yes and no. The hypnosis cannot be dangerous if done by professional. The hypnosis can be dangerous if done by people who think they are hypnotists, but they are not. For example, as I said, we cannot use word no. We cannot use negative during hypnosis session. Why? Because subconscious doesn't understand no, but subconscious understand the rest of the sentence. So let's say if I give instruction to the patient, you are no longer smoking. The subconscious remove no, and the subconscious store in the mind, you are smoking. Word no not exist. And now imagine the case which was in the United States some long time ago, I believe in 40s, in 1940s.
It's a while ago.
Yeah, it was a while ago. The about 50 years old gentleman came to hypnotist because he had suicide ideas. He wanted to jump down from the Brooklyn Bridge. The hypnotist was not really professional. He did not know 3 major laws of hypnosis.
Oh, I gotta hear this. What are the 3 major laws?
So what he said to the patient, he put him in a trance, he relaxed him, the patient appeared to be open for suggestion, and he said, you will not jump from the Brooklyn Bridge. 15 minutes later, this gentleman jumped because he missed word no. So, and he missed no word will. All he understood that you jump from Brooklyn Bridge.
So you simply just have to rephrase it.
Well, the professional hypnotist will never say no, will never say will. It's in our blood, it's in our heart. We are trained not to use this word.
Stick to the present.
Yeah. Even maybe you already paid attention. I'm talking to you now, and I'm not using word no. Mostly. This word not exist for us. It's a bad word.
In your vocabulary, just not there.
So I can rephrase in any way, but without no.
And so if you could just clarify again, what are those 3 laws?
Humor,
Okay.
future or past,
Okay.
and no, negative.
You gotta take the negative out of the sentence. Stay positive, right?
Stay positive.
Now, that concludes this interview. But make sure to stay tuned for our next program because we're going to have Victor's associate, Olga, who is a neurologist and certified acupuncturist, share her experience with acupuncture. It should be pretty interesting and revealing, so don't miss that one. Until then, I'm Frank Williams from Life Provision Studios. Take care of yourself.